Next session is being presented by Amy Thompson, who's an endorsed DN, and Kathleen Davis, who is an Aboriginal health worker. They're both part of the chronic enhancement team from Durri, which is near Kempsey in New South Wales.
Hello to everyone, my name is Amy Thompson, and I'd also like to introduce Kate Davis. We are from the Dunghutti Nation in New South Wales on the mid-north coast. Before we begin our presentation today, we would like to acknowledge the traditional custodians of this land and pay our respects to elders past and present. We are presenting on behalf of our service, Durri Aboriginal Medical Service. Kate is the Aboriginal health worker within the Chronic Enhancement Program, and I'm an endorsed enrolled nurse, soon to be a registered nurse, working in the clinic. We would like to tell you guys a bit about our service and how we conduct HbA1Cs and ACRs. So Durri is a Dunghutti word which means to grow in good health. Our service was established in 1976, operating out of Greenhill Mission in a small clinic. The name was given to the organisation by members of the Aboriginal community. In 1979, the service became incorporated and was associated under the Aboriginal Council and Association Act 1976. The value statement is to shift to excellence. Mission statement: we are the preferred provider of crucial primary health service and associated services. Durri ACMS offers a range of different services that addresses the well-being of Aboriginal and Torres Strait Islanders within the communities of Kempsey, Nambucca and Hastings regions. Our service provides chronic disease preventative health, dental, adult, child and adolescents, drug and alcohol, eye health, family support, hearing health, immunisation, maternal and neonatal care, mental health, sexual health, transport, youth support, women's health. We have 5 GPs, 3 part-time, 1 full-time and 1 registrar, and 1 drug and alcohol specialist part-time that does a 1-day clinic a week. We do INRs on site in the clinic, and other services that we also provide are our specialist services that require a doctor's referral. They also can come from Kate and her team through the Chronic Enhancement Program. We conducting the GP management plans and health assessments. We offer adult psychiatrists, cardiologists, child and adolescent psychiatrists, dietitian, endocrinologists, exercise physiologists, geriatricians, nephrologists, paediatricians, physiotherapists, rehabilitation medicine specialists, respiratory physician and speech pathology. So we provide appointments and a walk-in system. This is sick on the day appointments. All the patients for walk-in appointments are triaged by a nurse to ensure emergencies are given priority and appointments can be made by patients who require longer appointments or more convenient to their needs. We are a bulk billed service and are committed to preventative health measurements. So this is what we use as a quick reference guide from QAAMS, and it's a step-by-step guide. Gives us results within 6 minutes. We can print out the results from the machines, and then we put them onto our medical director for the GP to assess. And then that's our storage for the equipment. This fridge should remain at a temperature of 4 degrees Celsius, otherwise in a frame of 2 to 8 degrees Celsius. The cartridges inside this fridge should sit at a room temperature for 15 minutes prior to using. They can be stored at room temperature but must be used within a 3-month frame. And always check your expiry date and the heat sensitive pad. Okay, so that's our DCA Advantage. For our ACRs, we have 2 machines. These tests are performed once a year if the patient had a normal reading of an ACR. 6 monthly if showed microalbuminuria, and once every 3 to 6 months if they're on therapy. And it depends on their EGFR as well. We also have a renal nurse practitioner on site for any follow-up if the patients need any questions to be answered. And that's our HbA1cs. So this is a test performed for diabetes management, and the target for optimal control is 7%. It's carried out every 3 months, so that's 4 times per year. And that's because every 120 days the red blood cells die. And it's a less invasive test than the pathologist test. And you can also have a false reading if your patient is anemic. So this is the HbA1c converter. So on the old unit you have percentages. Now in the new unit that QAAMS is going to is the millimoles. And it's because it's consistent with most other countries. And that's some of our educational tools that we use with our patients to show them where they actually sit with their ACRs and HbA1cs and how much sugar is actually in their system. This is our endocrinologist, Dr. Durri. We do a monthly clinic with her via video conferencing. This is some of our statistical data. So on the first one, with the number of patients, 329, that was in 2012, there was 235 patients that were compliant and 94 of them were not compliant. Then the bottom one, where it says 353 patients in 2014, February, there was 274 patients that were compliant and 79 weren't compliant. Then on the 1st of the 9th, 2014, we had 363 patients through, 284 were compliant and 79 were non-compliant. And unfortunately, that is the end of our speech. So thank you very much.